Welcome to Cool Explorations.
On Thursday, November 21st, 2019, Prime Minister Trudeau had an in-person meeting with the Mayor of Vancouver, Kennedy Stewart. At this meeting, the drug overdose program was discussed and Mayor Stewart presented a request for $6 million of federal tax dollars to purchase clean and safe drugs for drug users in Vancouver. Vancouver Coastal Health is the organization applying for the federal funding from Health Canada. They claim that having the safe and clean supply of drugs to provide will prevent or at least minimize the fatal overdoses caused by drugs being laced with fentanyl and carfentanil, according to the Global News article. It should come as no surprise that Trudeau has not refused this request. In fact, the mayor has stated that he was open and encouraging. After the meeting, Mayor Kennedy Stewart had the following to say: Trudeau is open to having conversations and looking for us to lead with healthcare professionals to try and figure out the best solution, which is actually kind of sad and amusing. Our Liberal government is open to using taxpayer dollars to fund and enable Vancouver's drug problem, but they are not willing to help the rest of the West with their economic struggles, nor even listen to Premier Scott Moe about changes that needed to be made. I'm sure glad we have a federal party in place that is willing to stand up for Canadians so long as they are druggies or Eastern sheep. That way no one has time to think about the bribes and scandals we see from Prime Minister Trudeau, who should be in jail for his crimes. Stewart also stated earlier that he hates the idea of Western alienation, blaming it for hindering the drug overdose crisis and the housing crisis from getting the attention he feels it needs. He states, "I feel like we're being a little bit hijacked by Alberta's agenda. As a portion of the West being alienated, we must thank the Mayor of Vancouver for continuously thinking only of Vancouver and themselves, rather than thinking of the West as a whole. We in the rest of the Western Canada love the thought of being used and abused, then cast aside when detrimental government policies are implemented. People are starving, committing suicide, dying, and going homeless due to poverty, including our veterans, and yet the federal government and Mayor of Vancouver think that drug overdosing in Vancouver is a more serious problem. Yet our Prime Minister talks of speaking and working for the middle class. What about the fact that the middle class segment is declining as more people fall into impoverished categories, including our Indigenous and Inuit populations? The mayor has stated that Vancouver still has an overdose death every day, which shows how deep the drug problem does go. Vancouver's Chief Medical Health Officer, Patricia Daly, also supports having clean drug supply for Vancouver. City Council has already approved these requests to the federal government based upon the recommendations of Daly and BC's Centre for Disease Control. Trudeau had previously stated not being willing to provide this, but now seems open to the idea. This year, he had stated a focus on treatment programming funding, safe consumption sites, and methods of preventing harm. Trudeau must feel that providing clean drugs is a form of harm protection and prevention, which it is in theory, except for the fact that it also enables them to stay on drugs longer, since there really is less risk to drug use. Vancouver already has one of the few safe injection sites in the world. This has been controversial since it was founded. Opposition states that these sites encourage drug use and bring crime to the surrounding area, which is logical with making it easier and safer for addicts to get a fix. The pro side states that it saves lives and helps an addict reconnect to society, enabling them to get health services. Again, they probably do save lives and saves the spread of HIV and AIDS, but a better way to reconnect to society would be to make it harder to get drugs in the first place, not promoting drug use or providing funds for clean drugs. At these safe injection sites, addicts are provided with clean injection supplies to avoid disease spread. Healthcare in case of overdose, which comes in the form of staff providing breathing masks, naloxone, which is an antidote for overdoses, information on safe injection, and drug addiction information, as well as several other health services. These sites do prevent deaths, proof in the fact that no death has ever been reported at the Vancouver facility. Keith Humphreys does research in addictions and teaches psychiatry at Stanford University. According to NPR Health News, Humphreys supports finding better tools to combat the drug crisis. But he also states that although supervised injection sites don't appear to be harmful, they have not actually shown an increase in deaths due to overdose, or a decrease in deaths due to overdose. Likely due to the users of these facilities not solely using the facility. The Vancouver facility has enabled 3.6 million injections and has saved more than 6,000 overdoses, having no deaths since opening in 2003. The facility, Insight, claims that their presence has not increased or encouraged drug use, but the question for them is, how do you know how much a user is actually using outside the facility? And how do they know how much the addict used before they located the facility? Insight has claimed that overdose rates around the site decreased, yet the city still remains firm in their statement that the overall Vancouver rates have remained steady. They also claim that people using the facility are less likely to utilize actions that could lead to HIV and are more likely to use drug detox using treatments such as methadone. Yet still, we have not seen a decrease in drug use. Insight prides itself in being a non-judgmental place that accepts them for who they are. According to NPR Health News, is this really a good thing though? Yes, judging addicts is not the way to implement healing, but enabling the drug addiction encourages and makes it easier for them to continue using illegal drugs. Vancouver has actually seen a reduction in drug overdoses this year compared to last year. Suspected overdose deaths were 7 per week in 2008, according to Vancouver.ca. Yet the last couple weeks of October this year only saw 2 and 4 suspected deaths. The year 2018 saw 387 confirmed overdose deaths, compared to this year's 182 up to the end of August. A dramatic decrease in deaths without the funding Vancouver is requesting. If Vancouver is the focus of drug prevention, what about the rest of Canada? According to CCFA, Canadian Centre for Addictions, drug abuse has been growing in Canada, and the fight is quite costly, costing taxpayers $22.8 billion last year through treatment, policing, and equipment. Over the last decade, Canada has seen an increase in drug production exponentially, especially in the categories of producing ecstasy and methamphetamine, which Canada has quickly become known for making. This has also led to increased crime, gang violence, and violence in general. These drugs have been making their way around the world, particularly Australia, the US, and Japan. The supplies used to make these illegal drugs, however, come in through Toronto and Vancouver airports through countries like Mexico and India, although they are originating from China. With Canada's large borders and coastlines, it is difficult to prevent these drugs and their supplies from making it in and out of the country. Canada also has fairly lax drug laws, and the enforcement of these laws are laughable, being exploited by drug traffickers. The problem continues in the form of new and unique drugs making it to the country. Drugs our addicts are not used to having access to, which results in more overdoses caused from these new forms of drugs. Canadian citizens will be forced to deal with the consequences of a federal government that has allowed an easy path for increased illegal drug industry activity. Crimes related to this industry will continue to rise until something is done. Crimes like gang violence, drug seizures, and general crimes to supplement the cash of addicts to purchase increasingly expensive drugs. Dealers start using cheap rates to draw users in, and then they increase it slowly as addicts need more to meet their body's demand. With these facts in mind, a conclusion can be formed. Canada's federal government should not be using taxpayer dollars to fund the purchase of clean drugs. Enabling an addiction does not help an addict heal and reform. It will encourage problems with the addicts demanding more and more. Last I checked, these drugs were still illegal, though so is indecent exposure. But that law is ignored in Toronto rallies. Here's an idea. Instead of blowing millions of taxpayer dollars on safe injection sites and considering giving clean drugs to Vancouver, our government could invest that money in drug prevention and enforcement of our drug laws. One can argue about the money saving overdosing lives, but isn't prevention a way to save lives as well? Canada needs to strengthen our border security measures, make laws surrounding illegal drug use and supplying having harsher punishments, focus hard on seizing drugs and tracking down those making them, put more funding into drug rehab programs and research programs or methods of helping people stay clean. Don't use my taxpayer dollars to supply drugs for an industry that is illegal. To allow this funding of clean drugs would be just another criminal act by Prime Minister Trudeau. But he already knows that there is no way and no one who is able to hold him accountable. Since when has our Prime Minister ever cared about what the law states?
Remember to like and subscribe.